The patient is placed in the supine position, and a standard anterior midline incision is performed with the knee flexed. Femoral side osteotomy. Use the 8.0 mm femoral intermedullary drill to open the femoral medullary canal to a depth of 5 to 6 centimeters. Connect and assemble the distal femoral positioning guide and the distal femoral osteotomy adjustment device. Connect the grooved long intermedullary rod with the T-shaped silicone handle. Set the valgus angle according to the preoperative planning, usually 5 to 7 degrees. Slowly insert the T-shaped intermedullary rod into the prepared cavity. Attach the distal femoral osteotomy template to the anterior articular surface of the femur. Use the orthopedic positioning gauge to measure the adjusted resection thickness, which is generally set at 9 millimeters. Insert the fixation pin into the oblique pinhole on the osteotomy module. Ensure the template is tightly attached to the distal femur to prevent displacement of the module during osteotomy. Using the dedicated oscillating saw to perform distal femoral osteotomy along the guide slot of the distal femoral osteotomy module. Keep the saw blade stable during osteotomy to avoid an uneven resection surface. After completing the osteotomy, remove bone debris from the resection surface. Check the flatness of the resection surface and the amount of bone removal to confirm that the requirements are met. 4-in-1 femoral osteotomy. Use the anterior and posterior condyle positioning guide to measure the femoral condyle size and determine the femoral condyle specification. Adjust the IP condyle guide rotation angle with the wrench and confirm the correct side. Attach the femoral stylus and position the tip at the anterior cortex high point. Fix the stylus and determine the femoral size according to the IP measurement. Insert the fixation pins into the posterior reference holes on the cross guide as preliminary positioning holes for the 4-in-1 osteotomy. Remove the measurement plate. Select the appropriate size 4-in-1 osteotomy block and place it onto the long pins through the standard holes. Confirm the amount of bone resection. If necessary, adjust the resection amount using the knob on the 4-in-1 osteotomy block for plus or minus 1 flexion gap adjustment. After confirmation, fix the 4-in-1 osteotomy block using fixation pins inserted into the oblique holes. Use an oscillating saw to perform osteotomy of the anterior, posterior, and chamfer surfaces. Remove the oblique fixation pins, connect the slap hammer, and remove the 4-in-1 osteotomy block. Place the intercondylar osteotomy block on the distal femur and secure it with fixation pins. Ensure the block width matches the implant ML diameter and assess the final implant position. During placement, perform osteotomy along the guide slots. After the side cuts, use a narrow saw blade or osteotome for the transverse cut. Remove the intercondylar osteotomy block. Tibial plateau osteotomy. Connect the ankle clamp to the extramedullary alignment rod. Insert the adjustment rod into the fixation rod. Connect the ipsilateral tibial osteotomy block to the adjustment rod. Flex the knee, translate the tibia anteriorly, and secure the ankle with the ankle clamp. Install the tibial extramedullary alignment device on the lower leg and align the distal rod with the second toe. Align the osteotomy block midline with a medial 1/3 of the tibial tubercle and ensure the alignment rod is parallel to the tibial mechanical axis. After confirming alignment, insert a fixation pin into the osteotomy block slot for initial fixation and fine-tune the position. Install the tibial osteotomy stylus on the osteotomy block and position the stylus tip at the tibial plateau reference point. After determining the resection amount, insert the fixation pin into the hole marked 0. Secure the tibial osteotomy block onto the tibia, and additional oblique fixation pins are recommended for enhanced stability. Remove the extramedullary alignment device while leaving the tibial osteotomy block in place. Reassess and confirm the resection amount and posterior slope angle before performing proximal tibial osteotomy. Maintain the stability of the saw blade during osteotomy. If the resection amount is not appropriate, adjust the distal or proximal pin hole positions of the proximal tibial osteotomy block to achieve plus or minus 2 millimeters adjustment of the resection amount. Continue adjustment until the desired parameters are achieved. Insert the gap balancing device into the joint space to evaluate the extension gap of the knee. Insert the alignment rod into the gap balancing device to assess and confirm the overall lower limb alignment. The alignment rod should extend from the center of the femoral head at the acetabular, pass through the center line of the knee joint, and reach the center line of the ankle joint in a straight line. If the alignment deviation is excessive, correction should be performed before implanting the prosthesis whenever possible. Remove the proximal tibial osteotomy block from the tibia. Install the trial components. Holding the femoral component trial with the femoral component holder. Connect the universal impact handle and secure the trial component onto the prepared femoral condyle surface with the knee flexed. Select the tibial tray trial size that provides the best surface coverage. Install the insert trial thickness adjustment plate and insert trial. Then select the appropriate insert thickness and install it onto the tibial tray. After trialing, extend the knee and evaluate stability and alignment. Connect the condylar fixation post drill guide and drill through the trial positioning holes. Remove the femoral trial. Connect the universal handle to the tibial measurement plate. Select the appropriate tibial tray size and secure it. Install the tibial keel punch guide sleeve onto the tibial plateau and impact it to ensure a secure fit. Connect the keel drill to the power tool. Prepare the tibial keel through the keel guide sleeve until the depth stop is reached. Attach the appropriate keel punch and impact it through the guide sleeve until the depth stock is reached. Remove the trials and measurement plates for final implant placement. Prosthesis implantation. Apply bone cement to the femoral bone and implant contact surfaces while protecting the articular surface. Attach the femoral component to the holder, align the posts with the holes, and complete the final impaction. Remove excess bone cement. Apply bone cement to the proximal tibia and place the tibial component in the trialed position. Insert the polyethylene insert posterior side first into the tibial tray central post. Reduce the joint, apply slight axial pressure and extension, and wait for cement hardening.